Hello, everybody. I'm so excited. Dr. Fab Mancini is here. And if you have ever been on this webinar series before, you know there are very few people in this world that I love more than Dr. Fab. I love to tell amazing stories about the one time I was having a grumpy day. And I've got to tell this story because I still listen to this song all the time when I'm having a down moment, Dr. Fab. And I had a scheduled call with Dr. Fab, and this was several years ago. And we got on the phone. We were on the phone for maybe 45 seconds, and Dr. Fab stops me and he says, "Your energy is so negative today. What is wrong with you?" And I was like, "I'm sorry. I'm just having a bad day." And he was like, "Well, this isn't going to work for me." And he was like, "We just can't talk. Not when you're like this." And he like hung up. And then 2 seconds later, I get an email from him, and it's a video, and it is the Minions from Despicable Me singing the Happy song. And I was laughing so hard till I almost cried. And it still sits on the desktop of my computer 3 computers later because I'm never getting rid of this. And when I'm having one of those moments where my energy is kind of low and I am just feeling weary from the work at hand, I watched that video and it lifted me up. And the note said, "If you feel better after watching this, call me back. We still have 26 minutes that we can talk." And I immediately called him back. And that is what I think of every time I think of you, because you are so uplifting and positive, that I never want to miss an opportunity when I get to see you in person. Fab gives the best hugs, in case you were wondering. But he has just this amazing, generous, loving spirit and just this innate desire to be incredibly helpful to everyone he meets. It's always about what can he do to help you, whether it's to lift your spirits, introduce you to somebody, present you with some amazing new ideas and opportunities in chiropractic, which is what makes you such an incredible resource to all of us. And I am so incredibly grateful, just like you helping me out and being here today. So Dr. Fab, thank you so much.
So Christy, I got to tell you, I still remember that. But one of the things that I realized is that pretty much our state of mind dictates our state of life. And why would you want to engage in anything in life, whether it's a personal or a professional exchange, with a poor mindset, where you're not feeling good about yourself? Maybe you are having a bad day. Maybe you just got into an argument with a loved one, because then unfortunately, that exchange is never going to be the potential that it has. And, every time you and I get together, we always talk about how to make this profession better, how to support chiropractors in the field, how to attract more people into our profession, how do I get more patients out there that can truly value what we do. So for me, I've trained myself that every exchange needs to be when I'm on my best. And if I'm not, whether it's I'm seeing a patient or I'm having a call or having a Zoom call or I'm doing a lecture or I'm doing a television appearance or whatever, I just excuse myself and say, I'm going to need a minute or I'm going to have to cancel. Most of the time, I can get myself right on track very quickly. But if I can't, it's better for me to cancel just so I don't go out there not being at my best, because that's not fair to those that we are exchanging with, whether it's patients, other doctors, our own chiropractic assistants, etc. So I still remember that. And thank you so much for always being so kind to me. I love ChiroHealthUSA for many reasons, but one of the main reasons is the fact that they allow us to serve our patients in a way that is compliant, and when we don't get in trouble by maybe even charging different prices for our services. But then secondarily, it's always the support that ChiroHealthUSA gives to our chiropractic profession. And I don't mean just to scholarships to students, or perhaps supporting the state associations throughout the United States, or perhaps supporting the chiropractic colleges and in any way that they need, but also supporting us in the field with these webinars. I want you to know I'm a big fan of these webinars because we sometimes just need a little bit of a push. Maybe what we need is a little bit of a reminder that things are not so bad out there, and that we need to shift our focus and be able to recognize that opportunities everywhere around us, especially during this pandemic time. And that's the reason that I wanted to share with you some ideas, some insights, some observations, because remember, in my world, I get to experience different things. I get to experience what the chiropractor is going through on a day-to-day basis because of my contributions to the profession, whether it's my lectures or my exchanges with chiropractors, state association, colleges, etc. But also is my exchange with the public because of my radio and television appearances that I still do every week, and my lectures that I do to corporate America every single week. So I get to hear a lot of times what people are going through. And one of the things that maybe you have recognized already is that there seems to be a disconnect between we in chiropractic, right? Doctor, CA, spouse, everybody that becomes that chiropractic family, and the public and the communities that we try to serve. Many times, I never forget this, Christy, when I graduated from school, and I went, first I went to Florida for 4 months to do my internship so I can sit for the Florida boards with Dr. Jose Pelayo, which was one amazing experience. And then Dr. Parker taught me into going to Belgium, Europe for a year, where I practiced there and earned so much money that I was able to pay all my student loans within my first year out of practice. So that was a big blessing in my life. And then, of course, when I started my own practice, a couple of years later, after working with Dr. Parker and Parker University, I thought that as soon as I opened my practice, people were going to line up to see me because I was so excited about our value. I was so excited about what we did for people. I was excited about bringing this to that community. I knew that I was going to help a lot of people. And you know what happens? Nobody showed up my first day. And that's when I realized something very clearly. That disconnect in how we feel that there's so much value to us, but how others, the community, the public, may not feel the same way is a reality. But it's a reality that you can change. You can change it, not only in your practice by patient education, the way you create that environment that is a healing experience for the patient, the way that you create educational programs like your healthcare talks every single week, which only 3% of the profession is actually doing on a weekly basis. And it's still today, until today, the number one way to build a practice. But we don't do it. Now we have access to webinars, Zoom calls, that we can actually connect with our patient database and offer them great content where you can ask them to invite their friends and family and co-workers, but many people are still not doing that. So it is important to understand that that perception that we have is a reality. And then, of course, we know by the amazing study that Palmer University did with the Gallup study that shows that we still are serving less than 20% of the population. And many of those people that come, that 20%, they may come 2 or 3 times a year. So to me, that's not really the chiropractic lifestyle that I believe we all went to school for, that we learn about, that we practice, that we live, that our children live and our spouses and our significant others live. That is not once or twice a year. It is a lifestyle. I'll never forget when Dr. Phil asked me many years ago how often he should come after we finish his primary care, which took about 2 months to get him completely to a place where he was feeling amazing. And I said to him, well, Dr. Phil, I know that in school they teach us that maybe once a month or maybe even twice a month is a good practice as far as maintaining your wellness status through chiropractic care. But at the same time, I have found that for me, that's usually once or twice a week because of the level of intensity that I live my life, because of the level of contribution that I go out there and serve the world. And I'll never forget that he says, well, if you're going to do twice a week, then put me twice a week. And for years, he's maintained that. It's been almost over 20 something years. He still maintained that aspect of twice a week because he got it very quickly. So I want you to know that your patients will do what you do. So that's the first thing I want you to write down, is that your patients' behaviors is an extension of your own behaviors. Think about it for a minute. If health and well-being is part of your priority in life, and you wake up every morning and you maybe exercise, get your nutrients into your body, and all of a sudden you do your spiritual time and you do your positive mindset time, and you're ready to go to the office 100% to give your best to that community, what do you think your patients are going to do? But if you all of a sudden went out the night before and you drank too much, or perhaps you partied too much and you ate too much, and you wake up late and you're running late to your office where your patients have already been waiting an average of 15 minutes, and your staff is already concerned because they don't know how to make excuses for you when you're late like that, what do you think, what kind of day you're going to have? What kind of behavior do you think you're showing them? Are they going to be late to your appointments? Of course they are. Are they going to not take care of their health to the degree that you are? Of course they are, because they are an extension of you. You see, we attract who we are. That's the law of attraction. So if you want to attract better patients, just start improving your own life right now. If you want to get your patients to increase their patient average visits, you increase your patient average visits. You get adjusted more often. I'll never forget that even all the years that I practiced, the people in my community, which I've supported and helped many of them get into practice, because the more chiropractors you have in a town, the better and healthier that town will be. And the better that everybody does in that town. That's what I discovered when I was in practice. There is no competition among chiropractors because there is not enough chiropractors to actually take care of everyone in our hometowns. There's never been. And we need a lot more chiropractors to be able to support the majority of humanity. So I'm telling you right now, support your brothers and sisters out there. Don't look at them as competitions. Look at them as allies. Because the more that we educate that community, the more that we serve that community through chiropractic, the more chiropractic center that community will be. And what I realized is that as I started improving my health behaviors, I started attracting a higher quality of patients. And that was very important for me to learn at a very young age, because it allowed me to build the type of practice that I was really excited about. The type of patients that I was actually excited to look forward to seeing, rather than saying to myself, oh my gosh, here comes Mrs. Jones again, and here comes Bob, and here comes Sally. I've never felt like that, because every single one of my patients reflected an excitement towards health and well-being. And that's what I reflected. So it was synergistic. They were there for the right reasons. They came often enough. I remember one time when I started seeing patients' pain before they got adjusted. And I talked to my chiropractic assistant, and she said to me, she was a very wise woman, Georgia. And she said to me, well, that means that they're valuing and they're adjusting so much that they're willing to pay for it before they receive it. And then I start thinking about all the care plans that so many chiropractors offer, whether it's a 12 or 10 adjustments or 7 or 24, whatever. And to be able to create an exchange where patients can value something that they're prepaying for that they have not received, it all boils down to your level of certainty in chiropractic and your understanding that what you're offering can truly help them, because they will feel that. And if they can capture that, if they can know for certain that they're in the right place and that they're the right provider, then all of a sudden they don't question and they don't talk themselves out of, oh, I don't know if I can afford it. I don't know if I'll have the time to come 3 times a week. I don't know if this is right for me. Oh, my medical doctor said, be careful with chiropractors. They want to see you for the rest of your life. And all of those reasons that patients have given us as to why they don't want to engage in our care plan. So I'm here to tell you that your practice is an extension of you. And if right now, during this COVID time, this pandemic time, you want to attract and you want to retain more patients, then let's explore that. Let's explore the opportunity to say, okay, what examples can we show our patients and how to respond to this pandemic? Now, I've told you in the past that when the pandemic first started, I thought it was going to be a 2-week deal. In fact, I was telling and recommending my clients, the people that I mentor, some of the biggest practices in the United States, the people that I support, I was saying, take a vacation, take a break. Hang out with your family. They're quarantining all of us. They're sending us home. Just have fun with your family. That's what I recommended. Do something that you've been wanting to do for a while. Go clean that garage and go, clean up your house, or pick up a hobby, read that book you've been wanting to read. Do something for you. And then it went into 3 weeks and 4 weeks and 5 weeks and almost 2 years now. So I want you to know that not only are you frustrated, the public is frustrated. And that community that you're trying to serve, what I hear constantly is, I don't know who to believe anymore. I don't know if I can trust my doctor when they're trying to force and push things on us that we may not agree upon. I'm not sure that if I trust the chiropractors that actually did not engage me when all of this happened and told me that they were essential doctors and they were open and they were trying to take care of me and my family and my friends. I don't know if I trust the news because it seems like everything is scripted and it seems like they only have one thing in common and they're all trying to get everybody to do the same thing. I don't know if I trust the CDC or the WHO or the White House Commission on Health. I don't know who to trust anymore. So right now, the trust level with your patients, existing and inactive, is the most opportune time that you have right now. How do you build that? And you build it by showing them solutions where no one else is, by listening to what it is that their concerns. Mary, we're calling you because we were thinking about you today. We haven't seen you in a while and we're just wondering, how are you doing during the pandemic? What's going on? Tell us a little bit about yourself. And then Mary may say, well, I got laid off from my work. I've been trying to do little things here and there from home, or I haven't worked in 2 months. I'm having a hard time financially. Or it could be, I lost my mom, I lost my dad due to COVID. I've been sick. I don't know what to do. But you see, when you listen to your patients, all of a sudden now you have an opportunity to build trust. But if you're calling your patients to say, well, Mary, we were calling you because we need you to set up an appointment. We haven't seen you in 2 weeks and it's about you. What trust are you going to build with that? You see, people need to know you care about them before they care about you. It's a very simple thing that I heard many years ago, but I've never forgotten it because it is so true. That when you show care, true care to your patients, they all of a sudden begin to care about you. And now they feel more comfortable engaging with you and saying, yes, I'd like to set up an appointment. Yes, I would like for you to see my son or my daughter. Yes, I want to bring my husband or my wife because they've been struggling. Yes, I have some coworkers at the office that have been complaining and they don't have a chiropractor that they go to. Is it okay if I refer them to you? Trust is so critical during this time. And you get an opportunity to actually build that every time you see a patient in your office, every time you connect with a patient, whether through his phone, text, email, voice drop, do it all. Because you cannot connect enough with people because everybody's so isolated, disengaged, quarantined in some areas still. that they don't have enough touch, right? A big problem right now that we're having in the mental health problem is the fact that depression and anxiety have escalated to heights that we've never seen in the history of humanity. And that is because one of the worst punishments that you can give a human being is to isolate them from other human beings. In fact, as you know, that's one of the worst punishments when you want to torture somebody. If you don't believe me and you have a family, especially if you have children, many times I see parents that they feel still old-fashioned. I got to spank them to teach them something, or I'm going to punish them and take away something they love, like their phone or their computer, or I'm going to have to cut out the TV. When in reality, if you want to punish them, just ignore them. Just ignore them for a period of time, and you will see that they cannot take it because they need that connection. In fact, a lot of times I found that children misbehave not because they want to be naughty or because they feel like they want to be a rebel. It's because they're seeking connection and attention. So why not give it to them when they're doing something positive and overwhelm them with that? And that's one of our philosophies in raising our children, is always make a big deal of anything positive they're doing, anything positive they're thinking, and actually ignore the behaviors that are not so good. Because the children will respond based upon the attention that you give them on whatever they're doing. And that's one of the things that we realize, that when we celebrated even small little accomplishments so they were positive, all of a sudden they felt like they wanted to do that more. And then they put more effort behind it. And then they will come back and say, oh, Dad, look what I did now. And then you make a big deal again. And look what I did now. And you make a big deal again, because that's what they're seeking. So I want to ask you, what are you doing? What are you doing to connect with your community? Your existing patients, your inactive patients, and of course, the potential new patients in your community. How are you communicating with them? Many times I was listening to one of the top social media marketers in the country. She came as a speaker to one of my events that I mentor people. And she was saying that the biggest mistakes that we make whenever we communicate with our customer base, our patient base, is that we talk about us, all the things we're doing new. We're having this as a thing. We're having this sale. We're giving this. We're having that. All about you, instead of solving problems. She said that you can look at the conversions online on anything that you try to do, whether it's a post, a video, whether it's an online campaign, funnels, whatever. She says, what we have found is that the most successful thing that we can do is to keep bringing solutions to the biggest problems that people are having. So in your case, it's very important that you talk about what people are struggling with. Are you tired of being tired? Are you feeling that your body is not giving you what you know that it can? Are you struggling with pain constantly that you don't enjoy anymore the activities of your day? Talk about the things that matter to them. And then, of course, always give them a solution. And one of the things that I've recommended over the years is that when you give solutions, especially about chiropractic, make sure that you add some evidence or maybe a case study. Do it in a way that it protects the patient, but, share information. I like evidence-based because I know that the public out there, many of them don't think that we are scientific enough as a profession. So therefore, they question whether they should come to us or not. So if you give them the science up front, and we have many studies in chiropractic, as you know, there's a website that I constantly go to. It's the largest database of chiropractic research called ChiroAccess.com. ChiroAccess.com. And that's a site that I've always gone to because we use it when I was president at Parker, but that was our main site. And it was built by one of our top researchers, Dr. Ronald Rupert. in the profession. And I've always recommended that side to chiropractors. I always say, you want to get paid faster, put some evidence as to what studies do we have that what we do works. And the nice thing is that you can navigate through it and you can search for things very simply. I would do the summaries. You can also pay a little bit of money and get all the articles, but do the summaries. Make it short and brief where it shows the value of what we do. But you see, when you give people evidence, it builds trust, because now it's not hearsay anymore. It's about somebody else validating what we do. So when you do your post, put some social media, put some articles out there, so people can actually recognize, hey, in my review of the literature this week, I found this great article about, how to lower back pain or decrease back pain, or it could be something else, whatever it is. I mean, you have there all kinds of research. So I just wanted you to be aware of that right now, building that trust is really where it falls right now more than ever. The other thing that I wanted to share with you that I hear from patients constantly is that we want to go out there always with the chiropractic story, because we feel like if we don't say it, who will say it? The problem is that a lot of times the patients will say that they cannot relate to the chiropractic story because they don't know how it's relevant towards them. Meaning, first, you got to meet patients where they are, whether it's a new patient or an existing patient. And the way that you do that is primarily by asking the question, tell me what it is that you're struggling with. What is a health concern that you're having right now during the pandemic? Tell me, what are you worried about when it comes to your health? You see, you ask those questions, and all of a sudden, your patients, your significant new patient, or your potential new patient will give you, how do I want you to communicate with me? That's all they're saying. They're going to say, well, right now, I'm really struggling because my headaches are getting worse since the pandemic. Or ever since I had the virus, now all of a sudden I find myself very fatigued and I don't seem to have the same level of energy that I used to. These are all common problems that we're seeing. And that's why I keep reporting on that on the news and all the segments on television and radios that I do, is because the public is demanding solutions. But you should be the one giving those solutions, not me, you. But you do that by listening to them, by trying to identify what it is, and then tie in the value of the chiropractic care to that particular concern that they have. That's how you build trust. You know that if somebody out there, let's say you were struggling with something and somebody out there gave you a hand and helped you out, do you not think that you're going to trust that person more because they did something for you that made a difference in your life? Well, look at the way chiropractic patients refer to us, right, after they've been under care. All the miracle and the wonderful stories that we hear. If it hadn't been because of my chiropractor, I would have had to do this surgery. I would have had to be laid off work for so long. I would have had to not being able to play my sport. I would not be able to travel. I would have never been able to walk my daughter down the aisle. That's what they say. And based on our surveys, over 80% of our patients get well or improve dramatically with chiropractic care. So that means that 8 out of 10 people that we take in is most likely going to get better. That's a big number. That's a huge number in the healthcare space. Did you know that most surgeries are not effective, but people still pay $50,000 to $75,000 on a surgery, a replacement of a joint that is not going to give them what they think? Fusing a disc that is going to create more problems above and below that area in the future than they currently have? I mean, think about it for a minute. What we do is natural. We're not adding any toxins into somebody's body. We are not taking any parts away. We are not messing with nature within the body. We're actually just facilitating what the body already has. And that's the potential to heal. That's how I see our work. Our work, I see us as facilitators of healing in every single body that we touch. Every single body that we adjust, we are just facilitators. We're just helping the body enough so the body can do what it's meant to do in the first place. And yes, we talk about the fact that we do that through the nervous system primarily, but we also know today that that nervous system impacts pretty much all the other systems. So we know that what we do has tremendous value. So I'm bringing that to you because I want you to understand that the patients, is not that they don't want to come in right now. If you have a database of inactive patients right now sitting there, 2,000, 3,000, 5,000, and you're not doing anything with them, that is a mistake. I urge you to look at those as individuals that are struggling, because they are, at least the majority of them, that need your care today more than ever. It's a mission. You and your staff should have a mission to reactivate everybody that you serve up to this point in that office. And if you wake up every single day with that sense of urgency, I promise you, you're going to grow your practice beyond anything you've ever done. Even if it's just to call them, text them, email them, voice drop them, and just say, we miss you. We're just checking in on you. We wanted to know how you were doing. Please give us a call and let us know. You're not asking them for anything. You're just concerned, genuinely concerned about their welfare. And that's what patients respond to, right? If you call in just because you need another patient in that agenda, or because your CA is getting incentivized for as many people as they can reactivate, that's selfish. That's for you. Do it for them. Put their best interests at hand. And I want you to know that that's how you build that trust. I want you to know that this works. For some of you that are trying to communicate with new patients out there, you don't have to make claims that are not that you cannot substantiate. In fact, I don't recommend it. The last thing you want is for the Board of Examiners to write you a letter or call you in, sanctioning you because of something you said, because of the way that you interpreted what we do, because the way that you misled that patient into thinking that you could do something that maybe we don't have evidence to support that. There's no need for that. Right now, the majority of the people are looking for who can help me be healthier, because they're afraid. Fear is at the highest it's ever been when it comes to the health of humanity. And guess what? We are very good at what we do when it comes to the health of humanity. We are the first line of defense. We are essential providers. Some people even call us heroes, right? And that's what I want you to think of yourself. I want you to think of yourself as somebody that has a resource that desperately the public needs today more than ever, that can actually help people with their overall health and wellness, to be able to respond to all of these stress levels that we're feeling, to be able to respond to any virus or bacteria that comes close to us, to be able to respond in a positive way rather than in a negative way, to be able to be empowered rather than disempowered and become a victim. Patients don't want that. They're tired of that. And they're tired of being told that this is going to stay forever and that this is going to be a new way of life and you have to learn to adapt to this and you're going to have to wear your mask for a long time and you're going to have to do this and do that. We don't know where that's going, but we also know that there's a lot of differences of opinion out there when it comes to many of these recommendations. But those people, they don't have the trust that your patient has with you. They're looking for what you think. And what I've always said, be honest, be authentic. Don't try to sell on something that is not there. It's not necessary. In fact, when you do, unfortunately, that trust gets violated. And when that trust gets violated, it's very unlikely that they would ever trust you or refer to you again. So treasure that. Treasure that. And you do that by primarily just being sincere with them. You know, Mrs. Jones, I don't really know. I hear differences of opinion, But let me tell you what I'm doing in my life. Let me tell you what I'm doing for my family. Let me tell you what I'm doing for my children or my mom or my dad or my brothers and sisters or my grandparents. Honesty, you know, because the reality is that none of us really know. I can talk to my contacts at the WHO. I can talk to my contacts at the CDC. I can call the White House. And I'm telling you, no one knows for certain what's going to happen next week or the week after or the week after. Everybody's scrambling. Everybody's scrambling. So what does that mean? That your patients are very confused. That the community that you're serving right now is extremely confused. And you know what they're looking for the most? Clarity, simplicity. What are the action steps that actually make sense? Common sense. Some of the stuff they hear, it doesn't make any common sense, so they don't participate. But if you start making sense and keeping it simple and keeping it real and giving some evidence behind it, now all of a sudden you become the trusted provider that they're going to put their weight on. And the one that they're going to tell all their friends and relatives, hey, I know that you're confused. I know there's a lot of misinformation. What I love about my chiropractor is that she is honest. She gives me an answer. And when she doesn't know, she tells me she doesn't know, but she refers me to a website or two that actually have information that I can learn. See how simple that is? It doesn't have to be complicated. So what I'm asking you to do is to not waste the opportunity to connect with your patients right now. Because whether you want to attract new ones or you want to reactivate the ones you have or you want to retain the ones you have, I want you to know right now, connection is more important than ever. And what we have found is that a call is always the first level of connection, the most powerful one. Pick up the phone. All of you in the office, give yourself like a 30-minute window where you're going to call so many patients. And even if you just leave a message, Mary, this is Wendy. We're calling you from Mancini Chiropractic. Dr. Fab and us were talking about you today. We were just concerned and thinking about how you were. We haven't seen you in a while. Please give us a call and let us know that everything is fine. Something like that. The second thing that they respond well to is a text. I know that for the old practitioners like me, many times we didn't collect those numbers. We didn't get the cell numbers, but now many of the softwares are very text driven. So if you do have texting, do the texting. Third is a voice drop, a voicemail. Leave a message, because leaving a message is a voice. They can feel your genuine concern. And then, of course, lastly is an email. Emails, as you know, because of all the challenges that people are not utilizing the mail as they used to, the email boxes have been bombarded. So the opening rates for email have dropped below 20%. That means less than 2 out of 10 people that you email may even see that email. They're just too busy. Either they're not opening, either they're deleting, either they're unsubscribing you because they cannot take that they wake up one day in the morning and they already have 300 emails waiting for them. And it's mostly junk. Out of that, there may be 10 that actually people that really wanted to connect with you that you knew. So that's what's happening in that space. So that's why we do email, but we recommend the email not to be done until you've done the other ones, because you have more effectiveness. And then I also mentioned to you that one of the things that I've done is that I recognized over the last year and a half that there were 6 conditions that individuals were really struggling with because of the pandemic. And I'm going to share with you because I want you to talk about these conditions. This is what you need to be posting on. This is what you need to be asking your patients. Some doctors have actually created a checklist and asked the patients, are you struggling with any of this? So let me tell you what they are. Number 1 is fatigue and tiredness. It's crazy the amount of people, almost 2 billion people every single day, are looking for a healthy, functional beverage. They're either spending money on coffee, they're spending money on those energy drinks, they're spending money on sodas because of the level of sugar. So what we did is that we created a healthy energy powder that they can put just with water, that has over 35 superfoods, vitamins, minerals, all the antioxidants, everything the body needs, no sugar added, no caffeine, to help your body be the healthiest that it can be that day. And because it's healthy and functioning and you get the right nutrients, your body actually will have the energy that it needs to get through the day and more. The second thing that we found is that over 100 million Americans cannot sleep at night. So that means that, unfortunately, a lack of sleep has become one of the biggest challenges out there. So we created a product called Better Sleep. And Better Sleep is where we took the best of the best out there and put it all in one, or you take 2 capsules 30 minutes before you go to bed, and it gives you deep sleep, the best sleep you've ever had, because of all the ingredients that it has. The other thing is joint pain. So we have a product that has Perluxan. Perluxan has been scientifically proven to be one of the best ways to relieve joint pain, and we call it joint care. Why? Because many of our patients come because their joints are aching, whether it's their back, their neck, their wrists, their legs, their hips, their ankles. So that is something that we felt is very critical, because right now, due to the pandemic, a lot of patients have not gotten the care that they needed to, whether it's through their medical provider or whether it's through their chiropractic provider. So what's happening? The pain at home has increased dramatically, and they're struggling because they don't know what to take. So what happens? They end up buying more aspirin, more Tylenol, and as you know, those things are not the best to put in your body, especially when we have ingredients that clinically have been shown to be one of the most effective towards supporting your joints. The other one is weight control. The average American in the first year of the pandemic gained 15 pounds. It was called the quarantine 15. Now that number is over 25. That means that now going into the second year, people are really struggling with their weight and they don't know what to do. Well, part of the issue is the fact that they're not sleeping enough, they're not getting adjusted enough, they're not eating properly, right? They're stressed to no end. So what we did is that we did a program, a product that we took the 2 most powerful ingredients that have shown to lose weight and inches. Within a period of 18 weeks, you can lose up to 12 pounds. A period of 8 weeks, you can lose up to 16 pounds, sorry. And also, in our clinical studies, you can lose up to 4 inches during that time. But more than that, we added ingredients that keep you mentally healthy. You see, one of the biggest reasons why people are not eating well or not exercising enough, right, is because they're depressed, they're anxious, they're feeling down. So we put in ingredients that actually have been clinically proven to decrease depression and decrease anxiety and increase vigor and get you into a state of mind that is more positive. And that's where people are keeping the weight off. Instead of just losing it, they're keeping it off. Then the next one is immune support. And as I was doing segments on immune, I realized that science has told us that vitamin C, vitamin D, and zinc are very critical during this time. But then we also know that there's other products, ingredients out there like aloe vera and some others that are actually very good. So what we did is that we put it all into one product. Instead of people having to buy 2, 3, 4 bottles, and then where do they go? If they go to a CVS or any of these grocery stores, then all of a sudden you know that the quality is difficult. So if they don't know you, and we got some amazing nutritional companies in chiropractic, right? They're going to buy junk. So they don't know where to go. But because they trust you, if you offer them something that is all very easily contained, they're going to actually get it. We even added a product called nanocolloidal silver, which is one of the most effective ways against bacteria and viruses for the immune system. And then lastly is brain health. You have to talk about brain because people are thinking about brain. And what I mean by brain, I don't mean just the nervous system, right? That's what we work with every day. But it's also the concern that patients have, the community has, about the numbers on cognitive decline, dementia, Alzheimer's, forgetfulness, all of these things, fogginess. So we created a product that has some of the best omegas in the market, the purest, to be able to bring down inflammation and be able to help support the nervous system and brain health, we call it. So what we did is that I started doing this as a private label for me because I have hundreds of thousands of people that are following me. And I realized that the connectivity was so much bigger than anything I've ever offered because these are things that they're actually looking for, that they're struggling with. And now I'm going to be part of the solution. I'm going to be the one that is actually bringing them that solution. But because I was doing it for me, my manufacturer friend said, well, why don't you offer it to other doctors that want a private label, either their name or their practice name, and we can do it in quantities of 24, 48, or 72. So if you have a small practice, you can start with 24 of each of the 6 conditions. And then when you reorder, you can order 1 condition at a time. Or if you have a middle-sized practice or a couple of practices, you can start with the 48. Or if you have multiple practices or you have a very large practice, you can start with the 72. And what we're finding is that you can't keep them in the shelf long enough. But what we did is that we created an internal marketing program to be able to text, voice drop, email, social media marketing, to drive your customers, your patients, or your potential new customers to ask you whether that product is right for them. See, one of the things that I realized looking at the nutritional in our profession is that many chiropractors, we recommend what we believe in. But the challenge with that is a lot of times that's not what the patients are looking for. So that decreases our potential to really being effective in nutrition. Or perhaps we recommend something, but we don't educate them as to how important it is to keep taking it. So what happens is that the reorder on the second month, many times they drop by 30 to 50%. On the third month, they drop by 50 to 80%. Why? Because the patient has no incentive to keep it going. So what we did is that we took that out of the equation and we said, well, what if we create a program that when you private label, you have the opportunity to also have access to this internal marketing process that is turnkey. And all you have to do is send it to your patients, or we'll help you send it to your patients. And your social media, you can do it as a way of attracting new patients. Well, that's been revolutionizing the way that things are and practices are. So if you like that concept, if you like that idea, I want you to call me on my cell number. And I'm going to give it to you, but also, Christy, if you can put it in the chat room for everybody. But my cell number is 214-642-4911. 214-642-4911. 214-642-4911. And the reason that I wanted to share my cell number is that if you have a question or interested in it, I'll send you a link where you can go and gather more information. But I want to hear from you. I want you to call me if you have any questions about anything I've said. I want you to call me if there's any suggestions that you're looking for to be able to retain and attract more new patients. But more importantly, also be able to reactivate the patients that are sitting there collecting dust. This is our greatest opportunity that we've ever had, because we're essential providers, because people are putting health as a priority, because people are looking for simple solutions when the world is complicating it. And also the healthcare system has been stressed to no end that for them to see a specialist now, it will take between 6 and 9 months of waiting. As you know, many of the specialty practices are still seeing very few patients live. Some of them have gone into telemedicine, but many of them have just postponed their patients. And even my mom called me and said, oh, I needed to go after her stroke. She needed to do a reevaluation. And they told her that it will be 6 months before they can even see her. Can you imagine that? Waiting 6 months? But that's what's happening out there. So this is a great opportunity for us to position ourselves as the right provider, as the leader of the healthcare system, as the first line of defense, as the essential doctor that we went to school to be, but society has never recognized it to the degree that we do. And that's the message that I wanted to bring you today. I wanted to empower you, I wanted to empower you to recognize this is the best time we've ever had in chiropractic care. I mean, in the profession. 126 years, we have struggled to be in a position like we are today as a primary healthcare provider, as an essential healthcare provider, as a first line of defense because we're holistic, where we introduce no toxicity to the body, where we don't take body parts out of the body, but we actually help over 80% of the people that see us. That's what's exciting. That's why I get up every morning, and I couldn't be more grateful and blessed to be a chiropractor. I hope you feel the same way. I hope that no matter whether you're just starting in practice or whether you're a CA, or maybe you've been in practice 5, 10 years, or maybe some of you have been in practice 40 years. I want you to know this is our time. But it's up to us to seize it. Nobody's going to give it to us. We have to earn it. And we earn it by building trust to our existing patients and our communities. I gave you at least some suggestions on how to do that, but I want to make sure that you realize that it's really up to you. How bad do you want this? And it shouldn't be about just having more patients so I can make more money. Make it about making a difference in your community. I live in Dallas, Texas. I want to make sure that Dallas is the healthiest city in the United States because of the efforts in my team every single day. We're going to be educating the world, the community. We're going to be serving as many people as we can. We're going to be integrating some great services that people are demanding, including maybe this private label if that appeals to you. I can tell you some of the biggest practices that our clients of mine are doing it. Why? Because it makes sense. Go to the people with what they're looking for and then introduce them to your way of being. Chiropractic, everything that we are doing in our services, that takes sometimes a little more effort. But build that trust from the beginning, because when you help them, they're going to think of you and they're going to tell everybody about you, and they're going to participate and engage with you further because now that trust is built. That's what I wanted to share with you. That's what I wanted to bring to you. And that's what I hope that you're gaining out of this session. A realization that you're in the right time, you're in the right place, and you're definitely in the right profession. In my opinion, the best profession in healthcare. I've been given a lecture to the state associations called Chiropractic, the Most Essential Profession in Healthcare. And I go through step by step of our evolution and how we are now in a position where we can truly service the public. I've seen practices expand their services. Some of them do complementary healthcare, others integrative healthcare, and all for the sake of what? Serving more people. Are you doing that? Are you doing that to the degree that you feel excited about? So I want you to realize that this is a time for you to really shine. And I'm going to close, Christy, now with just letting everybody know that ChiroHealthUSA and Christy in particular get excited about putting these events. Why? Because they hope that maybe they can make a change in you. Yeah, I'm talking to you. All it takes is one. I know hundreds of people are going to be watching this, but what matters is you right now. And what choices are you going to make after listening to this? And what mindset are you going to change to begin to see what successful chiropractors are seeing every day? that there's never been a more opportune time to be a chiropractor today, regardless of the practice style that you have. This is our time. This is chiropractic's time. We just want you to go and be with us. Make this a mission. Make this a higher purpose. And then all of a sudden you'll see that the universe will reward you by attracting more patients into your practice that you can possibly see. So therefore, you can hire some of these young people graduating from our schools that don't have a lot of savviness in business, but they have a big desire to serve people. And that's what we want you to do, to hire as many young people and grow your practices to no end. Thanks, Christy, for having me.
Thank you so much, Dr. Fab. This just made my day. I kind of wish we would have started at like 8 o'clock this morning. I could listen to you talk forever. Hopefully y'all got some great ideas on how to engage with your patients. And I will say this, one of the things that I thought about while Dr. Fab was talking, a very good friend of mine in the Virginia area started posting videos of his team sanitizing the office and just what to expect when you come into the office. And what they saw was an uptick in number of their existing patients who hadn't been in a while, scheduling appointments and coming in because they felt like, the clinic was doing everything they could to keep them protected and safe. So, that's another great idea to reach out there, just letting your community know what you're doing, to keep their health and best interest at heart. So we have an upcoming webinar next week with my dear friend, Dr. Chris Patrico Napoli, who is a professor at Logan Chiropractic College. She's also on the upcoming ACA Women in Chiropractic Symposium. She's going to be doing a focus on women in chronic pelvic pain. So new topic, new speaker to the webinar series. I'm super bummed this isn't updated yet. Dr. Brian Capra has had something come up and he is going to have to reschedule. However, we have a fill-in. Don Rasmussen is going to be talking to us about how to prepare to maximize your taxes going into the tax season after the first of the year with some great ways to help you to save your money. And then we're going to have Dr. Mario Fusionary here at the end of the month talking about understanding the new updates to the ABN form, which I do believe go into effect on the 10th, but he will be here on the 26th. So make sure you go online to ChiroHealthUSA.com /webinars to register for those upcoming webinars. We will be announcing the November and December speakers in the next couple of weeks. If you have any suggestions, recommendations, or just a request for a topic or a speaker that you would love to see or hear from, please email me at Christy@ChiroHealthUSA.com and let me know, and I will work it out and make it happen. Ladies and gentlemen, I hope you have a fabulous day, an amazing week, and I will see you next Tuesday, same time, same place. Bye, y'all.